We want to welcome everyone today to our webinar on the Quality Payment Program Year 8 Quality Performance category. During today's webinar, we will have a brief discussion on performance category weights for the 2024 MIPS program, and then we'll move into a high-level discussion about the quality and cost performance categories in the QPP program. So the first thing we want to jump into today is your threshold and category weighting for Year 8. For 2024, the threshold to avoid penalty is retained at 75 points. This will allow for one complete performance year after the COVID public health emergency. Keep in mind that 75 points is the minimum final score needed to avoid a negative payment adjustment in the 2024 performance year. So this did not change from the previous year. As you can see in the chart on your screen, the final score thresholds did not change from 2023 to 2024. If you score between 0 and 18.75, you will receive a maximum negative payment adjustment of 9%. If you score between 18.76 and 74.99, you will receive a negative payment adjustment between 0 and 9%. If you score 75 points, you will receive a neutral payment adjustment. And then if you achieve 75.01 through 100 points, you will receive a positive payment adjustment up to 9%. Also retained for 2024, the complex patient bonus methodology, which is composed of two different calculations, your medical complexity and then your social risk. They are added together to determine that complex bonus.
So let's take a look at what you need to know about the basics and scoring for the quality category. For traditional MIPS, standard weighting for the quality category is 30%. For those of you with a small practice designation, quality will increase to 40% due to that automatic reweight for the promoting interoperability category that you do not have to participate in unless you choose to. So what do you need to know to get started with quality? The first thing is, for traditional MIPS participation, you'll be required to submit 6 measures. One of these 6 will need to be a high priority or outcome measure. There are specialty measure sets available that may have fewer than 6 measures, but if you choose to submit those specialty sets, you will need to submit all the measures that are included in those. There are 4 administrative claim measures that are attached to the quality category that can be attributed to eligible clinicians in addition to those 6 measures that you submit for quality. There are multiple collection types that can be used, and depending on the collection type, there could be an array of measures that you can choose from. Each measure is scored from 0 to 10 points. For small practices, there's a 3-point floor, meaning the lowest you can score on any measure is 3 points, regardless of benchmarks or data completeness. Small practices get 6 bonus points for submitting at least one measure for the quality category. There is a chance for additional points as well with improvement scoring. CMS will compare previous year performance to your current performance, and you can earn up to 1 percentage point for the category. So as I mentioned before, there are different collection types that can be used for the quality category. ECQMs are the most common type, and these are measures that your EHR vendor already supports. These are measures that can be used at any submission level from individual to APM entities. MIPS CQMs and QCDR collection types are measures that come from third-party intermediaries or CMS-approved registries. Claims are only used for small practices and come from the service codes on claims that are sent to CMS.
I want to highlight some quality measures that have been removed for 2024 that may impact your performance. You have your preventative care and screening influenza immunization and your pneumococcal vaccination status for older adults. These are removed from all reporting options beginning this year, performance year 24. This could impact some of your submissions. Some of our clients these have been commonly used with our clients in the past. The reason for the removal is CMS. There is a ECQM of CMS has created a duplicative measure, which is adult immunization status, and that's all inclusive of these immunizations or these vaccinations. Also retained only for MVPs, but yet they are removed for traditional MIPS are your breast cancer screening, colorectal cancer screening, and your BMI screening and follow-up plan. This is a big impact. This could be an impact for some of our clients because these are some common measures that have been submitted in the past. The reason for the removal of these measures from traditional MIPS is CMS wants to focus on a more comprehensive preventative care and wellness approach, which is applicable for some MVPs. So some of these three measures are found in some specific MVPs. Another impact for 2024 is benchmarking, quality measure benchmarking. So what does that mean? Quality measure benchmarks are the point of comparison CMS uses to score the measures submitted. So the performance on each measure is assessed against its benchmark to determine how many points that measure earns. So how are benchmarks established? Whenever possible, CMS will use historical data to establish those benchmarks. So the historical benchmarks for the 2024 performance period for the collection types that Jared just spoke about are based on actual performance data that was submitted for the 2022 performance period. The criteria in which a measure is scored against a benchmark, they have to meet the data completeness, which is 75%. They have to meet that case minimum, which is generally 20 cases. And then a benchmark has to exist for the measure collection type that the data was submitted through. Now, the common ECQMs that had no benchmarking for 2024 are your screening for depression and follow-up plan, your controlling high blood pressure, use of high-risk medication in older adults, your cognitive assessment, your functional status assessments for heart failure, and your statin therapy for the prevention and treatment of cardiovascular disease. These are your most common measures some common measures that our clients have submitted. This is a big impact. So it's really good right now while we're in the first of the year to look at some other ECQMs. That's part of your MIPS dashboard, that's part of your MIPS reports, and to try to identify some measures that can replace the measures that have no benchmarking. So if you have some measures that you've not submitted in the past because of low performance, you may want to start working on those measures, trying to improve that performance so that it can replace some of the measures that have no benchmarking. And remember, measures without benchmarking will score 3 points for small practices only. Now, if you're a large practice, you're going to get 0 points for a measure without benchmarking, but you will still receive 3 points if you are a small practice.
I briefly want to talk about MIPS value pathways or MVPs because the quality category looks just a little different through this pathway. The category weight still stays the same at 30%, but unlike traditional MIPS, you will only need to submit 4 measures from that selected MVP inventory. If there are administrative claims measures attached, you will just need to select one that you can report to as that foundational layer of MVPs. Any special statuses that you would have gotten with traditional MIPS will also carry over into MVP reporting. If you want to take a look and dig into these MVPs a little bit more, the MVP inventory for 2024 can be found at qpp.cms.gov, and you can really see what each one includes in the measures that there are attached. So how do you get started with reporting for an ECQM measure? The first thing you will want to do is see what ECQMs are available in your EHR, and reviewing those with your team and selecting ones that are meaningful for the type of work that you're doing in your practice. The next thing you'll want to do is go ahead and pull the baseline data and review those numerators and denominators for accuracy. And a good thing to ask yourself in this step is, does this accurately represent my patient population? That question alone can kind of guide your improvement efforts down the line. Uh, then you'll want to go ahead and pull those CMS measure specifications for those measures that you've picked, and compare them with the workflows in your EHR system. Find those trigger codes and phrases and make sure that you're capturing everything you need to get credit for that measure. Once all of this is done, select one or two measures to focus your quality improvement efforts on and create a plan to improve, and share those goals with your staff and providers, and work on improving your performance through those means.
We want to welcome everyone today to our webinar, the Quality Payment Program Year 8 Cost Performance Category. The agenda for this webinar today is we're going to go over some of the performance category weights for cost. We're going to talk about some basics and scoring for cost, and then we're going to talk about next steps, how to monitor those feedback reports. Alrighty, so for 2024, the cost category weights did not change from 2023. So we are still set at 30% for the category weight for traditional MIPS and MVPs. If you are a small practice, the category weight does say the same. There is not an automatic reweighting. The PI automatic reweighting does not affect the cost category percentage or category weight. The data submission is not required. Performance assessment is totally based on administrative claims only. For 2024, there were 5 new episode-based measures added. They are depression, emergency medicine, heart failure, low back pain, psychosis, and related conditions. Under traditional MIPS, you will be scored on each measure for which you meet or exceed the established case minimum. Case minimum is totally measure specific. If you don't meet the established case minimum for any of the available cost measures, the cost category will receive that 0 weight, and the 30% will be distributed to another performance category. Also for 2024, the simple pneumonia with hospitalization cost measure was removed. The cost performance category is a composite score. To trigger a cost category assessment, a patient or episode case minimums must be met on at least one measure. Cost measures can earn 1 to 10 achievement points. And beginning in 2023 performance period, MIPS eligible clinicians can receive a maximum score of 1% for improvement scoring. And we'll talk about that just a little bit more in depth here in a second. For traditional MIPS, there's a little bit of a difference between traditional MIPS and MVPs. For traditional MIPS, you are scored on any measure meeting or exceeding that case minimum, which we've mentioned. You are assessed on up to 29 of the measures for 2024. There's 29 available measures. You could possibly be assessed on all 29, depending on the case minimum criteria. For the MVP track, you're scored only on relevant measures within the MVP, which meet the case minimum, okay? And then, of course, if the availability and applicability varies per MVP. So that's the difference between your traditional MIPS and your MVPs.
This slide here shows all of the cost measures listed within traditional MIPS. I want to highlight that the case minimums for each measure do vary from 10 to 35 episodes, depending on the measure. I would recommend reviewing this list and compare to the types of procedures you're doing at your practice and looking into those measure specification sheets for the measures that could attribute to your eligible clinicians. Each measure specification will give trigger codes, and you can see what you're billing, and compare those. This is the best way to get ahead in cost because this category is scored at the end of the year based off of your claims measures that you're submitting to CMS. So cost also has improvement scoring like the quality category. Improvement scoring is done at the category level and will compare your current performance to your previous year's performance, just like quality does, and you can earn up to 1 percentage point for the category score. So two measures for the cost category are labeled as universal measures. They are total per capita cost, or better known as TPCC, and Medicare spending per beneficiary, known as MSPB. TPCC is a population-based measure that assesses the overall cost of care delivery to a Medicare patient with a focus on primary care, and is based on eligible clinicians' designation and plurality of billed E&M service codes. MSPB will assess clinicians on the cost of care for services related to qualifying inpatient hospital stays immediately prior to, during, and after that inpatient stay for a Medicare patient. This measure looks at a window that starts 3 days before the inpatient stay, the stay itself, and then 30 days past that stay. Clinicians that bill 30% of E&M codes for that stay will be attributed to this measure, and clinicians that perform related surgical procedures can also be attributed this measure.
Some steps you can take when analyzing your cost performance. Make sure you review those feedback reports. Look for patterns such as provider with higher costs compared to their colleagues, or patient populations with higher ER utilization visits or hospital admissions. You can also track those patients with higher HCC scores to help manage those costs. Get familiar with triggering codes for measures you could be scored on or have been scored on in the past. Monitor the patient population who have comorbidities, and review those field test reports. These present information about types of services included in an episode's cost and variation in cost measure performance across a different variety types of services. And also remember, the 2023 feedback report should be available for review in mid-July.
To wrap us up here, we have a couple of other webinars coming up. We will be discussing how to complete and prepare for SAFER guides in a pre-recorded video released on May 24th. And then we are back live on June 6th, discussing tips, tricks, and how-tos to interpreting CMS's cost performance feedback. So if you do have any questions or are considering seeking help with your QPP MIPS reporting, you can contact us by phone, email, or visit our website, all listed there on the right side of your screen. We are also on Facebook, LinkedIn, and X, and would love to connect with you. Thank you all for tuning in today, and we hope you have a great rest of your day.